Librax is a medication that combines two drugs, Clidinium and Chlordiazepoxide. It is used in combination with other medications to help treat stomach and intestinal disorders such as ulcers, irritable bowel syndrome, and bowel infections. Clidinium works by reducing the symptoms of stomach and intestinal cramping, slowing the natural movements of the gut and relaxing the muscles in the stomach and intestines. It belongs to a class of drugs known as anticholinergics/antispasmodics. Chlordiazepoxide helps to reduce anxiety by acting on the brain and nerves to produce a calming effect. It belongs to a class of drugs known as benzodiazepines. The recommended daily dosage and optimal timing for taking Librax should be determined by a healthcare professional, as it may vary depending on the individual's condition and medical history. Before starting Librax, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 3 to 4 times a day, 30 to 60 minutes before meals and at bedtime. If you are taking an antacid, take it after meals and take Librax before meals. The dosage is based on your age, medical condition, and response to treatment. Older adults usually start with a lower dose to decrease the risk of side effects. Do not increase your dose or take this drug more often without your doctor's approval. Your condition will not improve any faster and the risk of serious side effects may increase. When this medication is used for a long time, it may not work as well. Your doctor may need to increase your dose or change your medication. Talk with your doctor if this medication stops working well. Remember, this medication may sometimes cause addiction, especially if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. If your condition lasts or gets worse, make sure to tell your doctor. Some common side effects of Librax may include dizziness, drowsiness, weakness, blurred vision, dry eyes, dry mouth, nausea, constipation, and abdominal bloating. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. For dry eyes, consult your pharmacist for artificial tears or other eye lubricants. To prevent constipation, make sure to eat enough dietary fiber, drink plenty of water, and exercise. You may also need to take a laxative, so ask your pharmacist which type is right for you. Remember, your doctor has prescribed this medication because they have judged that the benefits outweigh the risks of side effects. However, if you experience any serious side effects, like decreased sweating, fast/irregular heartbeat, or signs of liver problems, contact your doctor immediately. In rare cases, a very serious allergic reaction to Librax may occur. If you notice symptoms such as rash, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Chlordiazepoxide, the medication found in Librax, has the potential for abuse and addiction, which can lead to overdose and death. It is important to take the smallest effective dose for the shortest possible time to reduce the risk. It is crucial to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking this medication, as it can lead to serious side effects, including death. It is important to know how to take chlordiazepoxide and what other drugs to avoid taking with it. If you experience very serious side effects such as slow/shallow breathing, unusual lightheadedness, severe drowsiness/dizziness, or difficulty waking up, seek medical help immediately. Abruptly stopping this medication can lead to serious withdrawal symptoms, especially if it has been used for a long time or in high doses. To prevent withdrawal, your doctor may slowly lower your dose. If you experience any withdrawal symptoms such as headaches, trouble sleeping, restlessness, confusion, depression, nausea, or seizures, inform your doctor or pharmacist right away. Withdrawal symptoms may persist for weeks to months. Before taking Librax, make sure to inform your doctor or pharmacist if you are allergic to Clidinium or Chlordiazepoxide, other benzodiazepines, or if you have any other allergies. It's important to also let them know about your medical history, especially if you have certain conditions such as glaucoma, difficulty urinating, stomach/intestinal problems, heart problems, high blood pressure, mental/mood conditions, or if you are pregnant or planning to become pregnant. This medication may cause dizziness, drowsiness, or blurred vision, and can make you more sensitive to alcohol or marijuana. It's important to avoid activities that require alertness or clear vision, and to avoid alcoholic beverages while using Librax. Additionally, it may make you sweat less, increasing your risk of heat stroke, so be cautious in hot weather and make sure to stay hydrated. Older adults may be more sensitive to the side effects of this drug, especially drowsiness, confusion, and unsteadiness, which can increase the risk of falling. If you are pregnant or breastfeeding, it's important to talk to your doctor about the risks and benefits of using Librax, as it may harm an unborn baby and have undesirable effects on a nursing infant. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using. It's important to be aware of potential drug interactions when taking Librax. Some products that may interact with Librax include potassium tablets/capsules, sodium oxybate, and drugs that are affected by slowed gut movement, such as pramlintide. Librax may also affect the absorption of other products, such as certain azole antifungal drugs and slowly dissolving forms of digoxin. If you are taking either ketoconazole or itraconazole, it's recommended to take it at least 2 hours before taking Librax. Other medications can affect the removal of chlordiazepoxide from your body, which may affect how Librax works. Additionally, cigarette smoking can decrease blood levels of chlordiazepoxide, so it's important to inform your doctor if you smoke or have recently stopped smoking. Taking this medication with other products that may also cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, may increase the risk of serious side effects. It's crucial to check the labels on all your medicines and ask your pharmacist about using those products safely. Lastly, Librax may interfere with certain lab tests, potentially causing false test results. It's important to make sure lab personnel and all your doctors are aware that you use Librax. If you or someone else has taken too much Librax and is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 to reach your local poison control center. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness, hot/dry skin, fever, severe dizziness, severe thirst, mental/mood changes, such as confusion, unusual excitement, fast/irregular heartbeat, muscle weakness, inability to move, paralysis, slowed breathing, fainting, and seizures. This medication should not be shared with others. In addition to medication, the management of digestive disorders may also include lifestyle changes such as stress reduction programs, exercise, stopping smoking, and dietary changes. It's important to talk to your doctor or pharmacist about lifestyle changes that could benefit you. If you are using this medication for a long time, your doctor may recommend lab and/or medical tests such as blood counts and liver function tests. It's important to keep all medical and lab appointments and consult your doctor for more details. The usual dosage of Librax is 2 to 4 times a day, taken before meals and at bedtime. It's best to take this medication at the same times each day to help you remember. And always follow your doctor's instructions on dosage and timing. If you forget to take a dose of Librax, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. Make sure to store Librax at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed. Make sure to properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.